The care is planned with you. Every care that your healthcare professional is going to be making, your midwife or your obstetrician, is made with you. And that is why it's important for you to get informed, seek knowledge, make your own research so that you can ask appropriate questions and make the right decision at the right time. That is life-saving. Hello and welcome once again aboard JulieCity. As usual, I'm always excited to be here, and I'm glad you clicked to watch today's video. You're highly appreciated. And this is the part 2 of the series on pregnancy and antenatal care. If you've not watched the first video, then I will encourage you to check out my channel to watch. I'll be leaving a thumbnail of it at the end of this video. Do well to click it. It will take you right to that video and you can watch. I'll also put a link in the description box, and if possible in the comment section, you can follow that link. Otherwise, you can always check out my channel and you will find useful and informative health talk videos to watch. So in today's video, I'm going to be looking at diabetes, gestational diabetes. In pregnancy, some women are prone to gestational diabetes. So with gestational diabetes, it starts mainly during the second and third trimester of pregnancy. And it's basically because the insulin, which is the hormone that helps to manage or regulate blood sugar in our system, begins not to be enough, because the woman's body in pregnancy has a whole lot of things going on, plus different hormones happening, and so the body kind of prioritizes what is needed. Unfortunately, it turns out to be insulin, and as a result of inadequate insulin in the body, the blood sugar begins to rise. And if caught on time and managed effectively, there's no problem. And that is why it's important in the booking appointment, which is that first appointment you go for your antenatal, that all your medical history is taken and you disclose as much as you can in order to help us plan that care for you for safety reasons. So diabetes is one of those information we are looking for. Now, if one is diagnosed of gestational diabetes, please, there's no need to be scared. I know it's easy to say don't be scared, but please, it's not a death sentence, if I might use that word. Many women birth their babies safely, even with gestational diabetes. The most important thing is finding it out on time, early detection, and good management. Like I said in my previous video, remember that pregnancy is yours. That pregnancy is the woman's pregnancy, and the midwives and the doctor or your healthcare professional is there to support you to deliver safely. And so it's also important for you to play a big part. Number one, I will say it again, get informed. And if you're pregnant or you're planning to be pregnant and you're watching this video, well done. That is a big step because you're seeking information. Again, the belief here on JulieCity is knowledge is power and our health is our wealth. So that's why I will say again, with pregnancy, the best practice will be to pre-plan pregnancy, especially if you already have a pre-existing medical condition. I can't stress that enough. That way, your healthcare professional will be able to effectively support you to avoid complications. Yeah, let's come back to it. It's not a death sentence. Rather, if caught early and managed effectively by you getting informed, disclosing all the relevant information to your healthcare professional, attending your antenatal clinics promptly and regularly, and making sure that if you feel anything different than the normal, that you contact your healthcare professional, keep all the appointments that are given to you, then by God's grace, things are working okay, because any complication that will want to crop up its head will be dictated on time and planned and managed effectively with your consent and knowledge. Remember, when you are well informed, you're able to make excellent decisions and choices. If you're not well informed, then where you need to say yes, you say no. And where you need to say no, you end up saying yes, or undecided for too long a time for things to go wrong. That is why I keep saying get informed. One of the other ways is antenatal classes, reading necessary books, taking advices that have been given to you, adding it to what you have found, and making the best decision. That helps with management. Now, what causes gestational diabetes, you may ask? Well, generally, not sure. However, there are a few pointers Number one, for a person with a body mass index over 30. So that is BMI is an addition of your height and your weight to get a figure which is plotted on a BMI chart, which is body mass index chart, to determine what number. And if that number is 30 and above, there are higher chances or higher risk, because of course that's obesity, and we know obesity is linked to diabetes. So yes, that's one. Number two, someone that is over 40 having a baby, the chances are higher. People over 40, even 50, have had babies without anything, but these are risk factors, so possible risks that can cause someone to have it. Remember, no judgment here. These are just things you need to watch out for. If you're 40 and you're intending to get pregnant, I don't want to scare you away. This video is not for scaring anybody away, but if you work well with your healthcare professional, things will be checked, plans will be made, and hopefully everything will go smooth. But I want to say that gestational diabetes is not limited to age over 40. Even people under 40 can have it. There are a few risk factors, like I'm saying. If there's a history, family history of diabetes, then the chances are also there. For someone who has had bypass surgery, any dietary surgery like gastric bypass or gastric sleeve, on a specific type of diet or meal, the risk is there. If you've had a previous history of pregnancy that had gestational diabetes, then most likely it will be happening again in this pregnancy. Like I said, just be open with your information that you give to your healthcare professional so that the right plan will be put in place. Any complication that might arise would have been foreseen and managed without the essence of emergencies, because emergency tend to produce more trauma. Now, for people who are from the South Asian population, Black population tend to have a higher risk of diabetes generally, and then gestational diabetes, which I encourage you also to find out more about. If you previously had diabetes or gestational diabetes in your previous pregnancy, then the chances are there. If you have babies that are 4.5 kilos and above, the chances are there. Like I said, there are chances, higher risk of having it. That is not an absolute that you are going to have gestational diabetes. It's just some of the things that have shown up over research for women who have experienced gestational diabetes. Women who have high risk factors of gestational diabetes, if dictated at the early stage during the booking session, are given the opportunity in their second trimester to undergo a specific test known as the oral glucose tolerance test, OGTT. That test will give a figure of your blood glucose level that will determine that the chances are high for you to have it. So you are put in a gestational diabetes care plan. Now, some of the other symptoms or signs that you will experience is tiredness, blurred visions, the tendency to want to urinate all the time, and then going to toilet and only having a little. Now, that can also be an impact of pregnancy due to the growing of the uterus, putting pressure on the bladder. But nevertheless, at the early stage, about that 24 weeks, you wouldn't have had that much of a tummy, except it's a multiple birth, to put that much pressure. So if you begin to experience that, it's important to speak to your midwife or speak to your doctor, depending on where you're listening from or where you live, so that they can check to make sure that everything is going well. So you'll be feeling thirsty, lots of thirst. You drink water, but you still feel thirst. Unquenchable thirst, kind of. Blurred vision, going to wee-wee all the time. Unusual tiredness, different from the one that is linked to the pregnancy. And a few more, which I'm going to be putting on the screen. So those are some of the things that if you begin to experience them and you've not undergone any of these tests, or you are not in a country where this test is happening, then please consult your midwife, consult your obstetrician to make sure that you get the care that is due you. Remember, if it is caught early, the chances for complication is greatly reduced. Now, you might say, gestational diabetes, so what? Well, some of the problems or complications that can arise from gestational diabetes, one, person tends to have, or the woman tends to have really large babies over 4.5 kg. And that has a lot of implications, because birthing that baby through vaginally can be a bit challenging. The tendency for episiotomy, which is a cut that is given to allow baby through, is there. The tendency for baby to get stuck in the birth canal or have what we call a shoulder dystocia. So the shoulder gets trapped in the pelvis and unable to navigate the birth canal, which can be very, very life-threatening for the child, and it can also lead to a lot of bleeding for the mom. So yeah, this is what we want to avoid. Then it can also cause respiratory distress for the baby. If baby is stuck there and because of weight unable to maneuver and time is going, babies might end up taking their first breath while they are still in the vagina, and that is not good because that causes a lot of complications, which might mean baby separating from mom and going to special care to be managed, needing oxygen and all of these other things, which we don't want. What we want is a smooth sail birth, happy baby, happy mom, and I tell you, happy midwife and doctor when that happens. The other thing that might happen is what we call polyhydramnios, and that basically means the fluid that is surrounding baby in the womb becomes too much. When the volume of water surrounding baby becomes too much, there's a tendency for baby to change position at the late hour, because it's like a large swimming pool. You can swim around the way you want, so baby might move away from the optimum birth position. It's also possible for the cord to come in the way of birth, which is life-threatening for the baby. It can also cause early birth, or what we call the premature birth. So if baby is born earlier than term, then the chances for going to special care or neonatal intensive care units is there. So separating from mom, which is not what we want, because that comes with its own history as well. Diabetes never likes to walk alone. That's one thing I don't like about it. It always likes company. And so with gestational diabetes, it's also possible, if not checked early and managed effectively, to have other things, something like hypertension and preeclampsia, which is part of my previous video, and I will encourage you to watch that as well. Another thing that can happen with gestational diabetes, if not treated effectively, is that the baby is at higher risk of having jaundice. Yes, jaundice that causes the yellowing of the skin and the yellowing of the eyes, and that comes with its own complications as well. Again, with a gestational diabetic mom, after baby is born, baby's blood sugar might be fluctuating, and that is simply because while baby was in utero, inside the womb, they were in an environment with high levels of glucose. So after birth, the glucose will begin to fluctuate as it's not receiving that high levels anymore. And most likely, these babies will have to go into the neonatal care unit in order to get the relevant care that they need, causing separation of mother and baby, which is not optimum for establishing feeds and all the gold standard care that mother and baby require at the start of baby's life, or at the start of this new phase of life for baby and mother. The worst case of it, of course, is stillbirth. Yes, gestational diabetes, if not effectively managed, can lead to stillbirth and a whole lot of other complications. So that is why it's important that you give relevant information, seek your knowledge, attend your antenatal classes, attend your antenatal appointments, attend every relevant appointment, so that you get the best outcome, which is a healthy mommy and a healthy baby, happy midwives, happy doctors, and happy family. Finally, you might be wondering, so what happens usually if a woman is diagnosed with gestational diabetes? So like any other medical condition, it's an individualized care. So it's specific to a particular woman, a particular person at a time. And so all the person's personal circumstances in terms of health and otherwise will be taken into account to reach a perfect plan for her. Generally, it starts with diet, some exercises, which is specific to that individual, and medications might come in. It might end up with some insulin injections if needed. And of course, a point might come when baby will need to be delivered in order to manage mommy's health effectively and also manage baby's health effectively. If that is needed, then an induction of labor, depending on the stage of pregnancy, or a cesarean section might be offered in order to ensure that mother and baby are safe, which is the ultimate thing that we want. If you're well informed, you're able to make the best decision for you and your unborn child. If you leave it to chance, you are taking a higher risk. So if you're going to take a risk, take an informed, well-informed risk. Again, I will say, if you're signposted to a specific information, reliable information, not them say, not horror stories. No, reliable information, reliable sources, which if you're in the UK, your antenatal or your green book has a lot of websites that are signposted. Those are reliable ones. Go there and read them. There are books available for pregnancies. Read them. Ask questions when you go for antenatal. Study to show yourself approved. Ask relevant questions. If you know what you're up against, then you can be specific in your prayer points instead of beating about the bush. So before you hurry up to make a decision, make sure you're well informed in order to make the right decision and choice for yourself, the safety of you and your child. I hope you found this video useful. If you have, don't forget to give me a thumbs up. Subscribe if you have not. Leave a comment or question. I would love to hear from you in the comment section. Share this video if you know someone who is pregnant or you're involved in a pregnancy. After all, knowledge is power. Till I see you next time, don't forget, your health is your wealth. Watch out for the next video. Do well to click on these videos popping up now. One of them is the one from my previous video, and one of them is the well suggested one to you by the YouTube algorithm has deemed that you might find it interesting, and I've suggested it to you. So do well to click to watch.